What is toe jam? Toe jam is a slang reference to the dead skin cells, sock fluff, surface dirt, sweat, skin oils and bacteria which tend to collect between a person's toes throughout the day. Poor hygienic practices or certain feet-related medical conditions such as athlete's foot can make the appearance and odor of foot jam even more noticeable. There's really no practical way to avoid some accumulation of dead skin cells, skin oils or bacteria between one's toes. Since all of these are organic in nature, in the same way that sweat, bacteria and skin oils can build up in the underarm area and cause body odor. A similar combination can cause toe jam to form between toes. Daily washing and scrubbing can reduce the severity and recurrence of buildup. But it would be impossible to stop dead skin cells or sweat from collecting between the toes. Some have compared the odor of toe jam to a pungent form of cheese, which may be the result of gases released by the odor-causing bacteria. Sock lint can also be attracted to the skin oils and sweat which build up whenever the foot is contained in a shoe for hours at a time. Dirt contained in shoes or deposited on shower floors can also become trapped between the toes. As long as a shoe or sock covers the foot, the generated body odor is relatively contained. But exposure of toe jam to the outside world can be unpleasant. Toe jam itself is not considered a medical condition, although it could be indicative of other serious foot-related ailments such as athlete's foot and other fungal infections. It is generally addressed by foot baths, professional pedicures, foot deodorants or medicated foot sprays. Wearing clean cotton socks and well-ventilated shoes should also help reduce the hostile foot environment which contributes to the build-up. Wearing clean shower shoes or flip-flops in communal showers should also help minimize odors and potential infections. Jam to toe treatment. Do toes require much attention? Yes, those 10 little digits are vitally important in keeping people upright. It's certainly reasonable that they should look and feel good too. After all, most people don't want to be friends with someone with icky, smelly feet or unusually colored toes. People get things between their toes and occasionally dry, peeling feet happen. Those impacted shouldn't worry too much if a bit of fluff is stuck in there. If it washes away pretty quickly, then you're good to go. Chronic trouble, though, requires more attention and shouldn't be ignored. Toe jam is highly versatile, but treatments exist for the different forms, allowing people to regain health and normalcy. The more awareness someone has, the better and easier it could be to find a resolution. Those impacted should work to understand why this condition is going on, closely examining the current state of their feet. Note what things look like, how they continue to change and how it's hurting their lifestyle. Then, work with simple hygiene procedures and medical assistance to restore your toes. What does toe jam look like? Ultimately, someone has a toe jam issue if there is funk and gunk in the toes. Like many things in life, though, it's not simple or pinned down to a straightforward definition. There is a scale of benign to concerning that people should note. A brand new pair of socks may feel comfortable at first, but if the owner didn't wash them, the cloth rubs between the toes, coming loose and sticking there. That lint turns the toes colorful and fuzzy. While this circumstance is relatively simple to resolve and causes little harm, it certainly creates frustration and fuss. Scabies are tiny mites that dig deep into the skin and set in an infection on the rare side. Those affected may notice small bumps between the toes similar to pimples. In addition, there is an intense desire to itch and scabs may develop. See a doctor immediately for proper medical care. While there, discuss how to keep this from happening again. Some skin conditions such as psoriasis and eczema impact the toes, creating flakiness and dryness. Thus, toe jam could be the loss of skin cells or irritation. Corn growth may not be toe jam on its own, but if you notice changes in the shape of an unpleasant aroma, the funk has settled in. Discoloration or a strong odor may also be signs of something developing. Some people sweat more than others. If the wetness lingers, a fungus starts to grow and the aroma permeates from the feet. Athletes or those on that stand most of the day may experience this frequently. While the stink itself is annoying, the long-term effect of leaving this alone could lead to a skin infection. The skin becomes extremely dry and itchy, with a rash possibly showing. How to get rid of toe jam? There are many avenues to eliminating toe jams. People can try everything from home remedies to seeking medical advice. These options help alleviate the discomfort and resolve the stench, itch, and flakes. Before you can eradicate it, you have to understand the source. Then, match that to the appropriate solution. Everyone should begin by focusing on daily cleaning habits. Sanitized feet are less likely to experience unwanted fungus growth and smell more pleasant. Wash between your toes regularly. Wear a clean pair of socks and avoid getting feet wet for long periods. Sometimes this is all people need to start fresh. Athletes or those with chronic sweaty feet should take care to find a good, supportive pair of shoes. Make sure they are made with breathable material. When feet heat up, they emit scents, so concentrate on creating a cool, dry environment. If it's tough to control, use powders between toes to absorb excess moisture. Cornstarch and talcum powder are both excellent options. With the right environment, toe jam should ease up and let you walk about freely. Also, don't forget to change immediately after runs, games, or events. Don't let the moisture sit for too long, or yuckiness will begin to fester. Speak with a doctor if any signs of a skin condition exist, such as crusts, pus, or flakes. Dermatologists or podiatrists can assess the symptoms and prescribe a home routine to minimize additional flare-up. This protocol could include prescription topical creams, smoothing out corns, and working with oral medication. When something seems amiss with your feet, toe jam could be the cause. Assess your current living habits to find the source. Then, make adjustments to provide a better environment for your toes.